Echo series. And thank you, Cassie, for the start the recording. So first, you are muted when you join the meeting, and please use the chat to communicate or unmute yourself if you want to, chime in. That is totally welcomed. And if you can, please keep your camera on because we want to see your lovely faces and have that conversation with you. But we totally understand if you're not in the situation to do so. Also, as we said before, this is an Echo series. Many of you have been attending our prior sessions as well. So if you wish to receive a completion certificate, please make sure that you are logged in with your first name and last name. At the end of the Echo series, we will be able to provide a completion certificate that will document all the hours you have been attending. So that's the certificate, and thank you for coming back again. Next, please. Okay, I know many of you have been coming back for and we appreciate you coming back to our sessions. We would still want to know who you are, and if you can write your name and your organization that you are affiliated with in the chat box, that would be great. And if you want to tell us what you hope to learn or gain from your participation today, that would be greatly appreciated. So today, Dr. Hassan Pao is not here, so I'm here. My name is Alice Zhang, and I'm a faculty member here at the KU Medical Center. And then today, our presenter will be Dr. Hacker. I will turn it over to Dr. Hacker so she can say hi and introduce herself.
Hi, everyone. My name is Rebecca. I'm a postdoc at Juniper Gardens Children's Center. And then part of University of Kansas. I was just telling them that my undergrad is in special education, and then I received my master's in special education from the University of Illinois, and then I also did my PhD in special education as well. And all of my research is really revolved around social communication and the use of AAC as well.
Thank you, Dr. Hacker. I felt like we actually have a lot of participants from school systems, so they would find your information really, really helpful. Next, please. So again, today we will have a short didactic presentation by Dr. Hacker, and after that we will have a group discussion with a potential case situation. So we are not having a case presenter today, as some of you who have been familiar with this kind of format, but we will have a case that's related to some social communication challenges. And then we will really rely on you all to have a really discussion on how we can, address those social communication challenges, and how maybe we can have some takeaway strategies that we can apply in our work with students or patients or clients. And also we have a level up sign here. So when you see this sign, we really want to hear from you. So when you see this sign up, please type in the chat box how you have applied concepts in your setting. Next, please. So assessment. So we have been sending red cap surveys to your email address. If you have left your email address, again, this is really, really important to us as we are funded by this grant. So we would love to have your data and to show it to our grant funder. So after this training, you will receive an email with a survey link from us. And I really, really appreciate your helping us filling that out. Next, please. Okay, so we were talking a little bit earlier that we have, after this session today, we have another 2 sessions for that that will conclude our Echo series. And one will be by Dr. Renee Jameson. She will be presenting on Girls Night Out, which is also social skills, but specifically for girls with autism and other developmental disabilities. And we will also have Dr. Allerbeck, who is a developmental pediatrician, who will present from a developmental pediatrician's perspective. And so if you have any cases, we would love for you to email us and fill out the cases so that we can have case presentations for the last 2 sessions. Thank you. Next, please. Okay, I will turn over the presentation to Dr. Hacker from here.
All right, great. Thank you so much for having me. I always like to say this when I start. I can tend to talk pretty fast, so don't be afraid to throw in the chat, slow down, or can you elaborate? I'm happy to do that. And for those who have just entered, my name is Rebecca Hacker. I have all of my education and experiences in special education. So my undergraduate degree is in special education, my master's was in special education, and then my PhD was also in special education from the University of Illinois. And I'm currently a postdoctoral researcher at Juniper Gardens Children's Center, and that's a part of the University of Kansas. A lot of my research really revolves around social interaction, social communication, the use of AAC. So augmentative and alternative communication for individuals with ASD and other developmental disabilities. And today, we're really going to talk about how to support children and support them typical development with atypical development, and how to support their interactions between each other, but how can you support them as a caregiver as well. Again, my background is more, I do have experience in a variety of ages, but predominantly with younger kids. So just to get started, we're going to talk about supporting social interactions of children with ASD and other developmental disabilities. The objectives that we have for today, we're going to identify benefits to social interactions between various children, and then we're going to discuss the roles of communication partners and what you can do, what we can have other people do who are not the active communication partner to support those social interactions. So to kind of give a little bit of a background, there's many benefits to social interaction, and I think that we can all agree that we could name a bunch of different great things that surround social interaction. And a lot of times when we think about development, we think about the child and then the environment, which is often surrounded by caregivers as children are learning language. And we often have to reflect on the type of language that we're giving them, and then the type of language we're receiving in return. And if we're not receiving, do we talk more often? Do we talk less? And we know that children learn language through social interactions with important people. So beginning in the beginning of their life, that's a parent, a caregiver, a sibling. And then as they transition to childcare, it might be through a daycare or a school or peers. And we know that children are social beings who require language in service of their needs to communicate. So it's one of the biggest things is we teach children to request, I want this, and then we give it to them, and we're cheering, we're sending off fireworks. Oh my gosh, you said it, here you go, you said what you wanted, and we get so excited. And then we can start to shape the communication that they have. And so when we think about the language input, so what we're giving to those children as they're communicating, we really want to think about the quantity and the quality of the different communication that we're giving. So our responsiveness to a child. Are we just repeating back to them what they're saying? Are we trying to shape what they're saying? And how can we support that to then help their development? So just to think about, given a lot of my research is focused on AAC, I find this very interesting. I think this is not only around AAC, but or just around development and language development. So by 18 months, babies have heard over 4,380 hours of spoken language, yet we don't expect them to be fluent speakers. So you think of an 18-month-old, think of how much they're talking, yet they've heard so much. Whereas if an AAC learner only sees symbols modeled for communication twice weekly for 20 to 30 minutes, let's say, for example, with the SLP, it would take them 84 years to have the same exposure to aided language as an 18-month-old. I think that's really powerful, because if we think about young kids who are maybe communicating less often or use aided language, we have to make sure that we're supporting the various ways that they can and that they do communicate. And not only us as a teacher or as an SLP or however we're working with the child, but how are the peers and how are their communication partners also supporting that? And when we think about young children in the early childhood center, for example, or even early elementary, we're thinking a lot on how these children are learning so much from their peers, and peers play a huge role. So this is a great opportunity to embed peers or siblings if you're working with families in the home. How can we embed typical development peers as communication partners to support that communication? Just to kind of dive a little bit more into the benefits, we know that there's social and emotional development. There's a sense of belonging. So when we think about a typical classroom, and the child might be pulled out of the classroom for speech support, and is it best for them to be in the classroom or pulled out? And after using those, making those decisions, how can we also support them in their sense of belonging in the classroom? How can we then translate what they've learned if they have gone outside of the classroom for certain instruction? How can we embed that in our classrooms and support them in that way as well? There is an improved quality of life. There's more social relationships. You know, think about your own self if you didn't have people surrounding you, and just having those social relationships, it can be tough to still feel engaged and have those interpersonal relationships. It's also generalizable. So if you think about how, if we're only talking with one individual, if I only use, for example, if I'm using a picture exchange, if I'm only using that picture exchange with my teacher or with my aide, am I ever going to be able to communicate that with a peer? Will the peer ever know what I want or what I need without teaching the peer to support that communication as well? And in friendship development. So not only are we teaching important ways to communicate and improving their social interaction and their communication, but we're also supporting that friendship development across similar age peers and like-minded peers with similar personalities. This is really an opportunity to utilize various peers in their environment, and supported by caregivers or teachers as well, to foster those relationships and then really watch them flourish. So when we think about, just to conceptualize this a little bit differently with more of an image, we have the roles of communication partner. So thinking of that top image, excuse me, we have this linguistic input. So we're using all of these words. Similar to how it's going today, I'm using these words, and then the strategies we talk about as a community here today, you're going to get to go out and talk about those as a community elsewhere, in your classrooms, with your colleagues, and then use with students or whomever you're interacting with. But we're also aiding it with, for example, this PowerPoint of being able to visualize how can I support the language development that we're using. And what that looks like, it could be utilizing pictures, for example, or actual images. So you'll see in the picture that's here, you have just, you'll have a toddler crawling in the top, and then the bottom, you'll see the toddler crawling with a car. So how can we utilize that car to support the language? How can we, as adult communicators, help transition that from just words? You're hearing all these words, how do I translate that into meaning? And that a lot of times we use aided modeling. So when we're thinking about aided modeling, is how can we really translate these words into actual meaning? So when we're talking about something, how can we translate that into, okay, we're going to play with the ball, you know, and to go get the ball. You could say, like, I have the ball, you know, take the ball from me, and you're using that while you're talking, so that they're able to relate what you're talking about. So when you're thinking about the roles of communication partners, and this is where it tends to transition from, okay, we have all this great knowledge. We know that language and social interactions is extremely important. Now, what can we do as communication partners? And many times, like I mentioned earlier, we're often talking about requesting. So that exchange of, if I say I want milk, you provide me milk, or if I use a sign for milk, you provide me milk, or if I show you a picture, and so on. So this exchange of, if I say something, I get it back. And this can be really challenging for individuals with autism spectrum disorder, as well as other developmental disabilities, because at times when we teach requesting, we know if there's a communication, they might get something in return, whereas social communication can be different, because is it reinforcing for them to have that communication back? So really finding things that are motivating for them. Do they want to play with Legos? Well, if you give them a board game and they're not interested in board games, social communication is not of importance to them. So how can we really transition this from what is important for what we want them to communicate, but how can we also reach out and see what they're interested in communicating with their peers as well? We don't want communication to be a chore either. So when we think about that requesting, we're often expecting the child to say what they want and then get what they're hoping for in return. And we continue to do this. Whereas how can we transition that to them communicating with their peer because they want to? And that's where we really want to utilize the peers in general. So when we model targeted language, we want to look at just their above their expressive language. So if we're seeing a child use one-word utterances, something that we can provide is two-word utterances as an example to reply to them in given examples. And we'll kind of practice this in a minute as well. So there's 3 ways you can provide high quality aided language input. So for example, if your student is utilizing AAC and you're using a picture communication board, the one opportunity you can have as a communication partner, and you can do this as an adult, or you can support a peer to also do this. So you can model keywords from your own interactions, a lesson or a book, depending on what you're doing in your classroom. So you're able to kind of, if you're reading a book, you can also look at the communication aid that the child is using and have your discussion or use your examples with the book that you're using their picture communication. It'll make sense on the next slide when I have a picture of it. Another thing that you can do is model words that map the student's focus or attention or action. So for example, let's say they're painting and you have, I never want to suggest painting to an early childhood just because I think of the huge mess that can happen. But when I think about painting, it's like if you have their communication, the communication symbols out, you're able to say, oh, look, you're using blue and touch blue, or their device and you can hit blue to describe what they're doing. Then they can make this association and they can draw their attention to their focus while just using communication in various words that they communicate with rather than just talking at them with your language. You're supporting their language as well. And the third thing that you can do to provide high quality aided language input is to model when responding to communication that the student is providing you. So for example, if the student is even engaging in challenging behavior, you can reply to them, you can respond to them using their alternative forms of communication, whether it's verbal or their input device or their communication system, whatever they're using. It could be an opportunity for you to just respond to them using their mode of communication. So I just gave you a bunch of information, but if you take a look at this picture and thinking about what we just talked about, this could be an example of just their communication board that they're working with. So when thinking about a child who uses AAC, for example, what are some of the ways that you could model words from your own interaction or for the child's focus of attention or to respond to the child? And feel free to just put them in the chat. Take a second and think about it. So to give you an example for the first one to kind of get mind flowing, if I'm, like I said earlier, if I'm painting with the child, I can say, oh, look, I'm painting, and I can touch painting. And I can also say, oh, are we all done? And I can describe what I'm doing using their communication device or their communication board while I'm also verbalizing it as well. So I'll go ahead and mute myself for a second. Go ahead and throw it in the chat. And you can pick A, B, or C. You can answer all of them just to kind of start that discussion.
So Dr. Hacker, I have a question. So when you think of a child who uses AAC, like for example, the second one for the child's focus of attention. So if the child is doing something there, when I teach the child to use AAC, then the communication has to happen through the AAC. Is that correct?
Yes, exactly. So for example, if you're noticing, so if you're interacting with a child and you see the child needs help with something, oftentimes we're saying, oh, do you need help? But if this is their communication board, for example, you could say, oh, do you need help? And point to you and help, or depending on their level of interaction and communication, you could just pick one. So for example, you could say, oh, do you need help? And you could point to the help. This would then encourage them to utilize their communication boards to communicate.
Perfect, thank you.
Christina said, so would it be a way to alter ASL to use symbology they are familiar with?
Yeah, that could you could use ASL. You could also use the symbols. That could be really individual focused. depending on what their needs are. It also could be a way to support if you want to bring peers into it too. So if you have a peer talking to a child who uses a communication board, it might be easier to teach it with a picture rather than the ASL. It might be a little bit more generalizable for various peers. Did that answer your question? Okay, perfect. All right, any other ideas around A, B, or C?
I have another question that may not directly relate to this, and
Sure.
we talked about a little bit earlier. I was thinking about children who potentially may have multiple modes of communication. So they might be using text, they might be using an iPad, some kind of app, but they might also having some signs or gestures, or maybe a few words. So when you think about a child who has multiple modes of communication, like, I guess, how do you decide at that point which mode of communication you are going to focus, and or does it really matter?
So it doesn't necessarily matter. I think some of the things that you can look for is what the student's most familiar with. So if the student really focuses and uses ASL might be a great way to start. If you're trying to transition a child to using a communication board, focusing on the communication board, but also supporting what they're already using is great. I really like to just channel the generalizability of what we're doing. So how can we make sure that the way that we're teaching them to communicate can be used across different settings with a bunch of different communication partners? So it can depend. I say child focus first, but then if you're learning something new and you want to teach something new to a child, really kind of focusing on what can I teach them that's going to help them be able to communicate with a variety of communication partners.
And Christina said that she works with elementary school students, so she likes the idea of using a style that can grow with them.
Yeah, that's great. So really thinking about like, how can I, even at one symbol, I know right now this has 12 symbols and that might be way too much for a child that you're working with, and that's fine. Even just starting with more and all done, right? So if anything that you're doing in your classroom, you can use more and all done. So how can we as teachers or caregivers use those more and all done, and how can we support their peers? So if they're done playing with their friend, it's completely socially appropriate to say, I'm all done playing, or let's play more. And you can kind of grow with them as they go. So really thinking about words that you can use across different settings. I think on here, thinking about the word paint is very specific, whereas thinking about the word more is much more generalizable. So any more ideas or thoughts before I move on? Okay, so kind of, and we talked a little bit about this, but when you're thinking about how to support that social communication, whether it be you as a caregiver, teacher, or with the peers, you want to make sure that you're using appropriate prompts to shape communication. So for example, if you're transitioning from the child solely communicating with an adult, then you want to help them support their social communication with peers. You want to use appropriate prompts to then shape that communication. You don't want them to be prompt dependent. Often try to express to people that you kind of want to work yourself out of a job, right? Like you want them to not need all those prompts to keep going. So this can vary by student and their target modes and the purpose and the situation, of course, but don't feel the need to be overly intrusive. When we think about young children who are learning that social interaction, things can get messy sometimes, and that's totally age appropriate and normal. But prompts should also be supportive and should be systematic. So you want to fade the communication prompts over time. So if you're starting to notice that that the child is either utilizing their communication board or their sign, or using even more language, you'll notice that they won't need as many communication prompts as well. Always reinforce desired behaviors. And it might be that when you're supporting peer interactions in the beginning, you're as the adult, you're often supporting and reinforcing, and that's okay. And then start to fade that away so they're not prompt dependent and reinforcement dependent. It's also really thinking about how to find the best peer in that situation that's going to benefit from having similar interests and similar personalities to effectively support the communication. And this can be a little challenging. So when we think about the learners that, when you think about the learners that you have in your classroom, you can pick who would work well with who. And that might be a great way to start to motivate them to want to communicate more, to want to play with things maybe out of their comfort zone, and really practicing that my turn, your turn. So finding an outgoing student where you're able to say, you know, you're going to work with this is going to be your partner for this session or for this play, for this structured play or this tabletop activity. And you're going to be able to use their communication skills to support the other learners' development and communication. And then you're going to be able to shape it and then generalize it to other students who may not be as outgoing or interested in the same things as well. So kind of reflecting on the things that we talked about today, go ahead and throw in the chat box any one of those 3 answers. You can pick all of them or just one of them. So what are your key takeaways from today? How will you apply this in your practice this week? And then what will you share with a colleague or a parent? Or feel free to throw out a question too if something comes up.
I felt like I have another question. I felt I have a lot of questions today.
Sure, that's fine.
So when you talk about communication partners, I felt like you mentioned like adults, like teachers, educators, but also like children, other peers, right? So do you have any suggestions regarding like how you can facilitate or foster a community of peer communication partners that is in this child's environment that can help that language growth? Yeah, because I felt like sometimes it's just like really hard when, you know, the other peers have so many other choices to communicate, right? And then it takes much responsive effort to communicate with this child who needs a little bit of additional support. So how can you keep that going? And yeah,
exactly. It's a really good point that you bring up. So when you think about when we're teaching young children in their language development, we're often having them interact with an adult. So how can we transition that to them interacting with peers? And I think that my first suggestion would be if a child has challenging behaviors, for example, you want to work with those and improve those before you bring other children in. Because, for example, if a child is really interested in something and you're working on my turn and your turn, for example, if they don't want to share, they have resistance sharing their toys, have them feel comfortable with an adult before you potentially bring a peer in. But also when you're thinking about communication partners and using peers, it's a great way. Kids shouldn't just be interacting with adults all day long. So how can we support that? We can bring typical developing peers in to support that language. We know they're going to be responsive and they're going to give many communication examples and language input examples. And one thing that we can do is we can teach them, just like we had talked about from the previous slide with that communication board image, is we can also teach them how to use it. So we can say, okay, when you're talking to your friend, use their talker or use their AAC device or use this sign to say your turn. And you can teach them how they communicate. So they're using the same modes of communication. And that's one thing a lot of the research has found, that when you're not using the same mode of communication, there's often a language disconnect. I mean, just think about if we're speaking English and you have someone that's not speaking English, how is that communication going to go? You can figure it out in various ways, but if we're not utilizing the same mode of communication, there's going to be that disconnect. And this is an opportunity to support the peers who are interacting with them by utilizing similar modes that can be understood by both. Did I answer your question?
Yeah, absolutely. Okay. That's really, really helpful. I really like the idea of, you know, really encouraging the peers and the target child using the same mode of communication. And I know that's not every school does that, but I heard in the past that some schools teach sign language from a very early on, and so that everyone can understand or use some basic sign language and things like that. So that might be a really good thing to do if it's possible.
Yeah, and what's great is you can't really go wrong with language input models, right?
Yeah.
So whether you're using ASL or you're using pictures or you're using text or whatever you're using, it's just more supportive. There's more ways for the child to learn. There's no right or wrong, it's just individualized. So you'll start to learn that, you know, he's not really responding when I use ASL, but when I use these pictures, great. Or when I use ASL, he's got it and he's starting to communicate with that. Let's keep that going. You're not gonna inhibit them from talking or using verbal communication. You're not restricting one or the other. You're just supporting a variety of modes of communication.
We have quite a few takeaways here in the chat. Colleen said, I will use more of the talking picture board. We have them, but do not use them individualized as much as we should. Christina,
so thinking about that one, I just have an idea with that one. So yeah, thinking about the picture board, I sometimes I can get overwhelmed with the amount of pictures on a picture board, and you're like, where do I start, kind of a thing. Just pick one for the activity, and it can be one word for the entire 30-minute game or activity you're doing, and just use that and start to introduce various ones for this lesson or this lesson. It doesn't mean that that's what you have to use every time, but if you're talking about something, whenever you say something where you could utilize that picture as well, it works. So go ahead. Sorry, I didn't mean to cut you off.
No, please cut me off always. Then the next takeaway was your last slide mentions communication partners. I think this idea with neurotypical students would be a great idea.
Yeah, which is awesome. I think that's a lot of where my research has gone. So just side note, my dissertation was all focused on siblings. So I did a sibling intervention. So that there's a great amount of research to support neurotypical students and their ability to help facilitate communication and use those peers, because they're the greatest models. And most times the kids are way more excited to play with their peers than they are with adults, in a way.
Absolutely. I also just want to add in that I know that we have a really great intervention called Peer Networks that is grown actually out of Juniper Gardens Children's Project or Center. So it really is supposed to be used in the school system to incorporate peers in the teaching and learning of language for kids with autism or other developmental disabilities. And then it's manualized, and there's research behind to support it. And so if anyone in the audience are interested in that, feel free to contact us. We actually do some training with it. So it'll be fun to do that in the school when you have access to your typical peers.
Yeah, those are great resources.
We also have Brenna, the importance of communication partners and teaching kids to communicate with peers, not just adults. Someone said adults need communication partners too.
True.
And my niece and nephew are nonverbal, 7 years old. I use the PEC system at school, but their parents don't continue this at home. Should they be using that at home too?
I would suggest yes. I think if they're using it at school and that you see that it's working or they see that it's working, it would be a great opportunity to transition that to home. And it could be just a simple training or a simple resource guide that the parents can utilize too, that could support their use of it at home too, because they might not see what you're doing at school. And they're not necessarily going to know how to use that, but if we provide them just a few ideas of when you're at dinner, you can do this while you're eating, or you can have them answer how their day was using this system. It might be a great way to transition them to feel a little bit more comfortable to use that at home. So I would suggest, yes, the more opportunities for communication, the better.
I feel like that's definitely a very common thing that the children may use a certain type of communication at school, but then like parents or grandparents, they may have a different way of communicating. Like, for example, maybe they understand the child much easier. They don't need that. They even can just understand if the child points to something. So they don't feel like it's necessary to use the pictures or use an other kind of AAC device. But really getting parents to understand that the communication practicing that is really helping the child to have a larger audience who can understand their communication. Is really, really important. Sometimes it's hard.
Absolutely. It can be really challenging. That's one of the things that the parents said too, is like, I always just thought they would call them talkers. So their devices, their AC devices, it was their talker. I didn't know I could have used it. And it's like, well, if we think about it, we're using the language we know, but we're not giving the children, for example, the way to communicate back to us because they're using a different mode. So try to find those common modes, which can be challenging and takes time to get used to. And that's why I kind of just start with one picture, start with one button, start with one symbol, start with one at anything to support their learning.
Alice, there was a question in the chat if you could send the peer network system via email following this echo.
Yeah, so if anyone is interested, just please feel free to email us. We don't really have a lot because it's a training, so there's really, I don't know whether there are some articles on that. We can definitely share with you about peer networks. Yeah, we will keep that in mind. But if you are interested in the training, please email us and let us know.
And then the last question here in the chat for you, Dr. Hacker, should the parents tell teachers and staff what they do at home for consistency too?
Absolutely. I think that just like we're trying to support communication across settings and with different communication partners for young children, we definitely want to keep the communication lines open for adults too. So anything that the parent is doing at home, whether working or not working, is a great way to transition that to school and vice versa. We're really working on more or all done. We're really working on these two. Can you use these at home? Or if they send it back to school and they're like, we're really struggling with this, or this is going really well, it could be a way to support that, the communication between both settings. And really, it's just going to help the child grow in their communication as well. Okay, so now we're going to kind of go into a hypothetical case situation discussion. So I'll review the information about the situation, and then we'll ask some questions and we'll kind of offer recommendations to our community as well. So I'll read through the case situation, and then here are some questions just to get us started with the discussion. And it's an opportunity for everyone to unmute themselves, use the chat, just to kind of think through some strategies so we can support each other. So this little guy's name is Peter, and he's in grade school and elementary school. He's male. Peter plays well independently and on their own terms with others. However, when other kids try to direct the play with them, they get upset and throw the toys. Additionally, Peter struggles with personal space. He gets really close with people when he wants to get their attention. He would even try to move other person's body or face to get attention. Peter is also really into jellyfish and will only engage in conversations surrounding this topic. If others try to change the subject, Peter will always bring it back to jellyfish. He has a hard time reading other people's emotions and cannot tell when they are bored, angry, or frustrated, and tends to just keep talking. So thinking about this case situation, just to kind of get the conversation started, and I'll mute myself for a second so we can let you guys talk a little bit about it. Is in what ways can we support his skills to gain attention with his peers or with any communication partners? And then how can we help to teach Peter about socially communicating with others? And I know there are a lot of things going on right now with Peter in this situation. So don't think that you need to tackle all of it in one setting, you know? So think about what's one thing from this case situation that you could help support him in.
Christina said, I'd teach him about personal space using a hula hoop decorated like a jellyfish. Hands stay inside the hoop. That would assist with social communication.
Yeah, that's a great idea. That's something extremely focused on something he likes, but also kind of supporting that he kind of needs to work on his personal space too. Great.
Please feel free to chat in, but also you can totally unmute yourself if you want to share your ideas. Again, I love Christina's idea of incorporating Peter's strong interest in teaching social space.
Sorry, I guess I'll go ahead and just unmute. I like to go off of the kids' favorites in order to find ways that they can be successful. So I'd even go as far as having a green jellyfish or a red jellyfish for everyone in the room. And if they're ready to communicate, they would show their green, or maybe even the teacher had a green. And then Peter would have a green or a red, depending on what his mood was for the day.
It's a really good idea. That's a great way for others to communicate with him non-verbally, and just kind of expressing their interests and if they want to engage. And I think that's extremely appropriate, because there's opportunities that we don't want to engage with others, and that's okay. And being able to express that is socially appropriate, and utilizing the jellyfish also brings his interest right back in there, which is great. I do see the chat of posed the question, sorry.
I think she was trying to say, like, what's
Sorry,
something
guys.
that your friends might be
Yeah,
interested
sorry.
in.
And you could use pictures.
Okay.
Yeah,
No,
that
you're
was
fine,
a
you're
typo.
fine.
Basically, I would say, like, and to maybe help if he didn't have any ideas of his own things that I've noticed kids being interested in, but maybe pose the question to get the empathetic conversation going on. Other people have other things that they're into beyond jellyfish, right? Like, what do you think some other kids might like to engage in conversation about besides jellyfish? Like, video games are big at my school, or Gaga ball is big at my school, just to help him see that maybe even if he doesn't really want to talk about it, that it might help to throw other ideas out there to get engagement.
Yeah, that's awesome. So almost giving choices in a way. So if we just think about, at this today, for these X amount of minutes, we're going to play with this or this, and so potentially giving Peter the choice, just so he has that ownership. And this can also transition into the peers supporting that decision as well. But since we want to potentially try to get him to not always talk about jellyfish, giving him an opportunity to make a choice where it's still his decision, but it's not necessarily solely focused on jellyfish, where other peers could be a little bit more excited about the conversation if you have peers that aren't really always interested in talking about jellyfish. So really kind of being able to teach that empathy piece of what's something somebody else wants to talk about or something else to engage in.
I feel like strong interest is really something a lot of times it can be really used in a positive way that can actually motivate the child a little bit more. So like in addition to offering him choices and also helping him understand this may not be something other people always are interested in hearing or talking about, I wonder whether it would be good to just there are different choices when I talk about this, but then if you are able to have a conversation with your peers about something that is not jellyfish, and then in the end of maybe, let's say we have 5 minutes, we're just going to talk about jellyfish, and then using it in a way that's going to help for or reinforcing for the child to be engaging in some other conversations.
Yeah, that's a really good idea too, is also being able to, you've made this choice, which is great. And I know you still want to go back and talk about jellyfish. So how can we reinforce you with that at the end? That's awesome too.
Any other thoughts, or just, I wonder, we talked about teaching Peter using hula hoop to teach him the appropriate personal space and a boundary, and that is great. And I think the question is, in what ways can we support his skills to gain attention? So even we teach him the appropriate social space, but he still needs to learn how to request that attention in a way that is not intrusive.
Yeah, and one thing that I think about a lot with that idea is the personal space or getting someone's attention. So one thing that we just talked about, providing those high quality examples, for example. So when we see that Peter wants to gain attention, we can, as an adult, potentially intervene and say, oh, do you want their attention? And then we can support, okay, tap their shoulder, or use the jellyfish as an example of how can we get their attention? Can we hand them a jellyfish card, for example, that says, I want your attention? So, utilizing that, oh, we see that we want to do this, how can we support that? Or when we're getting somebody else's attention, as an example, and Peter's watching, we can say, oh, I want her attention, or I'm going to go over and say, hello, and gain their attention this way, as an example.
Yeah, excellent. Go ahead, Christina.
I was going to say, I think that while focusing on Peter, we shouldn't underestimate his classmates' ability to understand what ASD is and how he communicates as well. And I've noticed that within our elementary school, the fifth graders or fourth graders, they're more willing to hear the jellyfish stories over and over and over and over again. And you can use that to your advantage. Like, would you like to tell him a jellyfish story? Why don't we hand him a green card? And so that he can learn, oh, green card is I can tell my story, or the interaction can occur. Whereas, the kindergartners don't really understand why Peter is behaving the way that he is, type thing. That's just kind of how I've noticed. But whatever I do with my kids, I just always have to make sure that he's successful every time. So if I'm a teacher within that classroom and I notice Peter's trying to hand a green jellyfish card to someone, and that person doesn't want that fish, then I need to take it so that he can be successful, so that he can link the green with the talk. So that's what I've noticed.
I think that's really important. I love that you brought it up. And I think a lot of times, just with that special education mindset, a lot of times we often try to change the behavior of someone else rather than looking around them and say, how can we change the entire environment? So how can we support both learners, both the typical development, the children with typical development and the children with disabilities? And I think you bring up a great point of like, how can we still, we don't want him to not talk about jellyfish, of course. This is something he's interested in. That would be no fun for you if you couldn't talk about things that you liked. But how can we teach him appropriate ways to communicate that? And how can we also teach peers to be responsive communication partners? And if you don't want to talk about jellyfish as a peer, that's okay. But how can we welcome that and support that when it's appropriate?
Absolutely. I really like that, just especially at the beginning of teaching that green card, using that card, you have to be able to provide that reinforcement every time for that behavior to be established. But I also agree with what you said, Dr. Hacker, about like, it is okay if a peer doesn't want to hear what you are saying. And it is okay that no teachers around at that moment that can be there to replace that peer to hear that story. So I felt like that's also part of it, like being generalized, being feasible in a natural environment, how we can teach that child, like, this might be a situation I can get reinforced, but sometimes you cannot be reinforced every time. But I think that's something that you can teach after that behavior, handing off that card is being reliably demonstrated. And then we can talk about how we can make it more like natural and generalizable to the natural environment.
Right. So exactly. When you're thinking about reinforce, and then shape, right? Like, how can we shape this? But let's reinforce it as often as we can. Goes kind of with a variety of things, of course.
Yeah.
Okay, so if there's nothing else I can, there's something else, sorry.
Yeah, no, I think that might be the one of the few last slides that we need to focus on. So with the time we have, I felt like maybe just in general, like questions that we have, regarding the content that you provided, and also maybe the case example, or maybe just like you have Dr. Hacker has a strong background in AAC and teaching children with using AAC. I felt like this would be a good opportunity just to ask questions that's in your mind. Any questions from our audience? I don't want to take all the opportunities to ask questions.
Christina asked, do you recommend a particular app?
Not particularly. I I usually use the touch chat, but just because I've noticed the layout is helpful and it can be pretty accessible. But again, not in particular. I kind of base it off of what students are, what their individual needs are, and what their skill levels are, and really consulting the looking at the results of the assessment, the AT assessment and the AAC assessment, and talking to the speech pathologist, and just being able to try out a variety of devices is awesome as well. So either the app or devices, whichever route you choose to go. So really, I believe most states had them. I knew Illinois did. I haven't really been too much involved with Kansas yet, but in Illinois they had a trial system. So you could contact I forgot the acronym for it, but it was an AAC assistive technology program through the state where you could request a device or request an app, and they would send it. You could try it for a few weeks, and you could just see is this supportive of the child's needs. So not necessarily. There's a lot out there, but I personally don't have a favorite or one that I guess I go to touch chat a lot, but just convenience, and it's simple for teaching that initial language. You're welcome.
If you have used certain apps that you find really helpful, feel free to chat in as well, so other people can maybe give it a try. So the one that you mentioned is Touch Chat, right?
Mm-hmm. Touch Chat.
Perfect. Okay, do we have any other questions before we move on? Yeah, I'm gonna ask my last question.
Okay.
So kind of, I already brought that up a little bit earlier, but I just wonder, like, when the child has multiple modes of communication, sometimes it's hard because, you know, the time or effort or resources are limited. You want to, you know, focus on teaching the child some certain mode of communication, but at the same time, you don't want to be like ignoring the other modes of communication. So I just wonder, whether it's okay to just be focusing on multiple communication modes, or you just need to pick up one to focus on when you are like trying to teach.
Sure. So I would say initially, I would say it's very individualized focus. I would say try a variety in the beginning, see what works for each child. See, you know, particular child, and you're like, I don't know where to start with this little guy. You can try a variety and say, yeah, that one's not working. This isn't working. And then starting there, and not keeping them all going, but also respond to any type of communication they engage in. So for example, even if you're like, we are going to focus on picture communication, or let's stick with picture communication for E. Let's say we are going to focus on picture communication, but the child signs something, respond to it. Great job. You know, this is what you signed, and you can respond to them using that communication board or that device or whatever. You can respond to them using that, but always reinforce any form of communication and try to shape it. So even if it's challenging behavior, respond to it, shaping it to change it to a positive way to communicate, or, you know, as needed.
Yes, that's really, really helpful. So just, you can focus on one or two communication modes, but always respond and reinforce any type of communication.
Exactly.
Yeah, perfect. Thank you.
Mm-hmm.
Yeah, we can go to the next slide if we don't have
Okay.
any other thoughts or questions from the participants. So again, thank you all for coming today, and thank you, Dr. Hacker, for having this wonderful presentation on social communication. I will finish this thought, and then we can come back to one question in the chat. So again, the next session will be Staying Socially Connected Girls and Adults by Dr. Jimson, and on October 18th. So we would love to see you back. And we do have a question in the chat.
So my student is smarter than he lets on, and he won't work for us. At what point do you stop giving him choices? So I would say in me being unfamiliar with the child, thinking about that situation, I would utilize a lot of potentially first then or immediate reinforcement for what needs to be done. So if you find something highly motivating for that student, don't give choices anymore. Say this is what needs to be done, and then you'll get this reinforcement. Keep it small in the beginning. If it's math, you have one math problem, and then you get this thing for a minute or things like that. So if you looking at this behavior, I would say immediate reinforcement of positive engagement in what you're requesting that they do, and choices may not be the best option.
Absolutely, first then is a good strategy. Okay. Thank you everyone for coming today. And again, if you can help us finish the evaluation survey that we will send out later today, that'd be great. Thank you. Also, we have a case conference that we provide as part of the grant as well. So if you need a more in-depth consultation for a case, we would be happy to schedule a conference call. So you can feel free to email us at cdenny@kumc.edu. Thank you all so much. Have a wonderful day. Thank you, Dr.